Now, COVID-19 has impacted all spheres of life. The country is in lockdown. Majority of people are home, out of work. As the lockdown bites, it has increased tensions within households and created a fertile ground for domestic violence. Police reports indicate that cases of gender-based violence have risen sharply in different parts of the country. Now, children are out of school and they will continue to be for a little while longer. They're experiencing the violence firsthand. As the parents and caregivers fight, children are not far away. They are watching, listening to the verbal exchanges, watching the physical fights. Last night, in his address to the nation, President Museveni spoke about domestic violence. He was very particular about the protection of children while calling for dialogue in families. Tonight, we speak to Timothy Opobo, the Executive Director, AfriChild Center, Makerere University. Thank you so much for joining us.
Thank you very much, Josephine.
I've seen it a couple of times, domestic violence called the shadow pandemic. Do you see us getting to a point where we have this kind of pandemic?
Yes, I think we already at that point. I think, first of all, as a country and globally, the issue of domestic violence is something that we have been facing. The circumstances that we are under right now have only created fertile ground for an increase in domestic violence. And so we have a silent emergency within an emergency. So that is the current situation. And as you rightly said, you know, with the media reports that we are getting now, with the police reports, and even with global reports from the World Health Organization, we see a rapid increase in domestic violence. And as you rightly pointed out, unfortunately, this has a direct impact on children. And it is also important to note that while we talk about domestic violence, there is also violence that is directly meted at children. So
all right, we're going to get to that violence, but do you think we are giving this the attention that we need to give it?
No, not at all. Definitely, we are focused very much, and probably in the interim, rightly so, on prevention of transmission. How do we stop the COVID virus from spreading widely, and rightly so. But beyond that, then we speak about the economics. But the social side of things is being ignored, like nothing is happening, because it is seen as software. But it is not software. It deserves equal attention.
A lot of people were up in arms the first time the president mentioned domestic violence, and he was very casual about it. So I can see where you're going with your thoughts. What do you think is driving domestic violence right now during the lockdown?
Well, a number of factors. First of all, as you know, with this pandemic, our life routines have been disrupted. People's livelihoods have been disrupted. People are complaining about no jobs. People are speaking about the loans that we have to pay. But beyond that, there are direct problems of hunger that people are facing in their households. So with all this, this just kind of gives room for stress within the family. And the coping mechanism sometimes we don't have, and therefore people then resort to violence as a means of addressing the challenges that they are facing. And that's what we are seeing right now, that because of the stress factors that have emerged, children are at home, you have 10 mouths to feed. You thought the children were going to be...
all the time. Everybody's eating more than they were eating before.
And the expectation, the children still think that they can eat as much as they have been eating, but it's not the case because people don't have the income that they had. And so with these stresses, tension is developing in households. And it's not just the economic side, but also the social side. There are incidences of people have not been used to actually staying in a confined environment. The areas where they're able to go and relieve themselves are closed. Whether it is going to extended family, whether it's going to friends, that is all shut down. And so the avenue now that people have, unfortunately, the response is violence, and that's the unfortunate thing.
The children are watching, the children are listening. What then is the long-term and the short-term effect on them?
The children are listening, the children are watching. But beyond that, sometimes the children are caught up in the scuffle between the parents, between the adults. So you have very many children that are getting physically abused because they are caught up in the mix. But then there's the emotional side, and the emotional side is long-term. It has long-term consequences. We're talking about mental health issues, stress, depression. All these things are consequences, and they have long-term effects on these children. But we must also understand that the behavior we exhibit sometimes is what our children will then exhibit when they're adults. So we are recycling bad behavior by demonstrating that this is the way you cope with stress. And that's where the problem is. All
right. I hear you. You started to speak about the different forms of violence that the children are experiencing during this period. Speak to me about that. What are they seeing besides the physical abuse and the emotional?
So first of all, I just want to echo that I work with the AfriChild Center, and we are a research center. And from the evidence that we have generated in the field, one of the key things is that many of the people that abuse children are people known to them, people close to them. So with the lockdown, many of the abusers are actually locked down.
You're together.
You're together in the same space. So what is happening? So children now are experiencing physical abuse. Many of them are being beaten, are being maimed. Children are experiencing emotional violence because people cannot cope with this stress, and therefore it's called displaced aggression. So you met it then on the children because they are the easy target. Yeah. But beyond that, we have to not forget the girls, because as a country we have a very unfortunate high rate of teenage pregnancy and a high rate of sexual abuse. You know, we did a national study on violence against children in this country with a number of partners, and the study clearly demonstrated a high level of sexual abuse. So in this lockdown, the chances and the risks are high that children are also experiencing high levels of sexual abuse.
Well, before the lockdown, we had a couple of weeks where social media was awash with comments about head teachers and people in positions of power abusing the children, the students, and all of that. Where are we on that? Is that something that AfriChild took interest in?
Yes, the issue of, I think that what you're speaking about is really abuse of children in within higher levels of or high institutions of learning.
And the children are going to go back, not even high institutions of learning.
Actually, within learning institutions, let's put it that way. And we already have a huge amount of evidence that is demonstrating that even within our schools, children are not safe. High levels of sexual abuse by those people that are supposed to protect them. It's not just head teachers.
What do we do about it?
Well, there are a number of things and recommendations that we have put forward. We even put recommendations to the parliamentary committee that was set up to investigate this. And what needs to really be done is we need to have, the law needs to bite. The sanctions need to bite. You cannot have a head teacher sexually abuse a child and the best you do is move them from school A to school B. We need to be able to deregister these people. We need to be able to take their licenses. But beyond that, they need to face justice. They need to face the law. And I think that way we work towards combating this kind of habit. But we also need to empower children. Children need to be given the awareness that they are able to report, they are able to speak out. We have a culture, unfortunate culture, where we think that children should be seen, they should be around, but they should not be heard. So children need to be given the voice to be able to speak out. They need to know that it's unacceptable for this and this to happen to me. And if it happens to me, this is where I go for redress.
And I think in this period of the lockdown, when the parents are spending more time with the children, now is a good education moment to just take the time and speak to them about what they should allow and what should raise the alarm bells. The police recently released the Crime Report 2019 showing that defilement remains a major problem in Uganda. There are 13,613 defilement cases in 2019. What do we do to bring those cases lower?
Well, there are a number of things, again, that we need to address at a policy level, but also at an awareness level, at a community level. So it's not just one thing that we have to do. But one of the biggest challenges we have as a country is law enforcement of the law. So as a country, we have all the laws that are available for us to actually prosecute people that do these things. So we have a law that is very strong against defilement. However, if you look at how many times is this law enforced, is where the problem is. Why? Because many of the victims don't even know what the law says. Secondly, justice is costly. Justice is costly in this country. So we need to have child-friendly justice system where children and their parents are able to get justice at a minimum, because these are not things that we can trade off. The costs are high. And once we have these laws and they're not biting, then they're pointless. So we really need to have effective enforcement of laws as a critical thing. Two, we need to address the issue of social norms. So we have norms in our culture and practices that actually encourage some of these things, especially issues around early marriage, and the gender perspective towards girls as well. We need to change the mindset, because this mentality of thinking that, oh, a girl cannot make it, or a girl at a specific age is ready just for marriage, is something that we still have in our communities and we need to address.
All right. Timothy, as we close, because our time is quickly spent, what is your parting shot for the viewers, for the parents at home that are watching? And I'm sure you have something to say for the lawmakers, the government.
Well, I think for the parents at home, I just want to encourage all the parents out there, first of all, to understand that you're not in this alone. This is a problem that we are all facing as parents. It's a global problem. And I just want to encourage you to step up at this point, to be able to provide the care and support that your children need, to be the voice of hope to your children at this time. Let us not be the ones that become a secondary problem to our children. Let us model positive behavior so that when we come out of this finally, children will have picked positive lessons from us as parents. To the government, we need to invest not just in our health system, we must also invest in our social protection system so that we are able, in terms of crisis, to respond not only to the health issues but also to these social issues. At the end of the day, we don't want to come out of this with broken children and with broken families. Otherwise, then what's the point?
All right. Well, thank you so much, Timothy Opobo, the Executive Director of AfriChild, Makerere University.